Kisumu, and currently working under a reproductive maternal newborn child and adolescent health program, but mostly focusing on sexual reproductive health as a sub-program. Just to begin, thank you so much once more. As a department, we have activities that forms part of our work activity as a department, and these activities we have obligation as a county to work with some other partners who also work on the same program, and we have to acknowledge that we have worked all along with Kisumu UHC Alliance, and for some times we have done quite a number of programs with them, and some of them run from policy to activities. And I can remember very well that some of these activities, some of them have been achieved, some we are on the way, probably will achieve some other time. Now, the Alliance has done quite a number of activities, and we appreciate as a department that most of the activities that were done were running on policy. I remember the Alliance supported the county developing family planning CIP, that is contraceptive implementation plan, and I think that is one of the greatest achievements that the Alliance has supported the county with. Another area that I will talk about is the RMNCAH has got the technical working group, and the technical working group was not working initially, and having sat together with the Alliance, and we came with a resolution probably to work together and strengthen the TWG. So I think the last meeting that we had obligation to develop a TWG that will be helping the department in steering the RMNCAH activities within the county. I think this is another second great achievement that we developed the TWG formation, and currently we are in the plan, probably next week with the same Alliance, so we are developing the subcommittees of the TWG, and we formed the 4 committees, subcommittee, that is family planning, SRH and RMNCAH, that is maternal newborn health, and also we look at some other areas that may support the RMNCAH program. So I think we also have to look at some other areas, like several meetings have been organized in support of the county to bring in some other partners through what we call the stakeholders meeting and forum. The Alliance generally has done some credible job in the past, and we believe will still implement quite a number, which the county has in its annual work plan. There are certain areas that I think also we as a department, we have to appreciate the Alliance has brought insight, and that is particularly on the budget. I know quite a number of us at the department haven't been privy on the budget, but I think with the insight from the Alliance, we've been able to relook at our budget because the county has got its annual work plan, and out of the annual work plan we have the RMNCAH budget, and this budget normally what happens is that we may not meet the budget as expected, but the expectation of the budget can also be strengthened by our partners, and Alliance is one of them. Now, our budget initially was like 2019-2020 was around 60 million, and we were not able to meet some of this money, but I think with the leverage from other partners, including Alliance, some of the activities which were budgeted under the same budget we were able to meet. Though it is small, we haven't gone much to satisfy our need, but then I believe the budget has gone somehow a long way. Now, there are certain gaps, like not meeting those standards of our expectation in the budget. Another area, there are so many plans like developing the strategy on SRH that internalizes the county's perception of the health on sexual reproductive health that we haven't met. We haven't also met quite a number of areas like probably commodity management and access to the general women of reproductive age has been a gap. We haven't also done much in engaging the community, because RMNCAH basically involved in engagement of the community to the grassroots. We haven't done this well because most of our activity has been at the higher level, and probably engaging the community will give a better result when you involve the community, talk positively on the negative issues and the positive aspect of RMNCAH. I think this is one area that we need to explore together with the Alliance. On the policy, I know the national government had come with a policy, but that policy is not yet ready and it was called back. Meanwhile, we are using the current policy that falls within the county, and this policy is which was developed way back. As a nation, we have two levels of government, the national and county government. And the national government is responsible for the development of policy. And for this case, RMNCAH program, they developed RH policy 2020. And the reproductive health policy was developed for the whole country. And later on, there are certain issues that came up, I think, with the advent of corona pandemic. Quite a number of issues cropped in, and some of them were that younger generation were engaged in provision of family planning, that is adolescent, without the involvement of the guardian and the parents. And I think you know very well what the directive of our president towards reproductive health on that line, particularly on contraceptives. So there are so many other input which were also, the national government needed to, the counties to have input. So those inputs needed to be consolidated, and they had to be consolidated further at the national level. So with the advent of coronavirus and certain emerging issues at different counties regarding the access to contraceptive, there were need to record this document back. And I think each county, particularly even Kisumu, had their input, and they had sent their input through the Council of Governors. And I think we hope in near future we are going to have this good document back and be able to implement it as a department. We also have a strategy that we started developing with the Alliance, but it is not yet ready, and we hope when we have enough funding, we'll be able to do this. Advocacy needs to be strengthened one or the other, because advocacy toward the activities of RMNCAH is what will turn and bring the behavior change among the community or those consuming the RMNCAH activity or program. So I think advocacy needs to be strengthened across the board, and that are through the media, and media has done recommended job, but though we need to escalate it to the grassroots level and engage the community more. And also the media that capture the interest of the young people could be so much important, and we need to look at this and open more spaces for the younger generation, also whom we intend to enable access the RMNCAH activities and services. One area that we need to do better is to engage the community. We have quite a number of population within the grassroots that need to be engaged.